patient stung multiple times by wasps develops facial angioedema, wheezing, and a blood pressure of 74/40 mmHg. The first-line medication the transport nurse should administer is a intramuscular epinephrine, B. for diphenhydramine, C. bromophor methylprednisolone, D. nebulized albuterol as the sole treatment. The correct answer is intramuscular epinephrine. Anaphylaxis with airway involvement and hypotension requires immediate IM epinephrine as the first line, life-saving treatment. Antihistamines and steroids are adjunctive and have a slower onset. It does not address the acute airway and cardiovascular collapse. After loading a 5-year-old patient who is intubated into the transport vehicle, the flight nurse notes decreased expansion on the left side of the patient's chest. The nurse should A. insert an orogastric tube, B. increase the tidal volume, C. assess the endotracheal tube depth, D. perform a needle thoracostomy. The correct answer is assess the endotracheal tube depth. Movement during loading commonly shifts a pediatric endotracheal tube. Unilateral decreased chest expansion after a position change most often reflects mainstem migration, so tube depth should be reassessed before assuming a pneumothorax or making ventilator changes. Tranexamic acid, TXA, is most beneficial for a trauma patient with significant hemorrhage when administered A. within 3 hours of injury, B. at any time up to 24 hours post-injury with equal benefit, C. only after blood products have already been transfused, D. exclusively for penetrating trauma, not blunt trauma. The correct answer is within 3 hours of injury. TXA is an antifibrinolytic that reduces mortality from hemorrhage when given within 3 hours of injury. Administration beyond that window has not shown the same benefit and may be harmful, so early administration is emphasized in trauma protocols. A patient sustains a traumatic amputation of the lower leg with active bleeding controlled by a tourniquet. Regarding the amputated part, the transport nurse should A. wrap it in saline moistened gauze, place it in a sealed bag, and keep it cool on ice without direct contact. B. place the part directly on ice without any wrapping to maximize cooling. C. submerge the part directly in saline solution. D. leave the part at ambient temperature to avoid tissue damage from cold. The correct answer is wrap it in saline moistened gauze, place it in a sealed bag, and keep it cool on ice without direct contact. Amputated parts should be wrapped in saline moistened gauze, sealed in a plastic bag, and kept cool by placing the bag on ice. Direct contact with ice or submersion can cause tissue damage, frostbite maceration that reduces the chance of successful replantation. Transporting a patient against their will is best described as a battery. B. malfeasance, C. beneficence, D. negligence. The correct answer is battery. Battery is unauthorized, harmful, or offensive physical contact with another person, transporting a competent patient against their expressed will, without legal authority to override their refusal, constitutes battery even if done with good intentions. A patient rescued from a near drowning in cold water is unresponsive, apneic, and pulseless, with a core temperature of 28 C 82.4 F. The transport nurse should recognize that resuscitation efforts should continue, since hypothermic patients may survive prolonged arrest and are not considered dead until warm. B. be terminated immediately given the prolonged submersion. C. be limited to airway management only until rewarming is complete. D. focus exclusively on rewarming before any resuscitative efforts begin. The correct answer is continue, since hypothermic patients may survive prolonged arrest and are not considered dead until warm. Severe hypothermia slows cellular metabolism and can be neuroprotective, allowing for favorable neurologic outcomes even after prolonged arrest. The guiding principle in hypothermic cardiac arrest is that a patient is not considered dead until warm and resuscitation efforts persist. A patient with blunt abdominal trauma develops a rigid, distended abdomen, rising peak airway pressures, and decreasing urine output during a prolonged transport. The transport nurse should suspect A. abdominal compartment syndrome, B. diaphragmatic rupture, C. splenic laceration without ongoing bleeding, D. mesenteric ischemia unrelated to intra-abdominal pressure. The correct answer is abdominal compartment syndrome. Rising intra-abdominal pressure from ongoing hemorrhage or edema can impair venous return, elevate diaphragms, raising airway pressures, and reduce renal perfusion, the classic triad suggesting abdominal compartment syndrome. A patient with decompensated heart failure has bilateral crackles, jugular venous distension, and an oxygen saturation of 88 on room air. Chest X-ray shows pulmonary edema, which intervention is most appropriate as an initial step. A. Non-invasive positive pressure ventilation and diuresis. B. A 500 ml normal saline bolus to improve cardiac output. C. Placing the patient supine to reduce work of breathing. D. Immediate intubation without a trial of non-invasive support. The correct answer is non-invasive positive pressure ventilation and diuresis. Cardiogenic pulmonary edema is treated with non-invasive positive pressure ventilation to reduce preload afterload and improve oxygenation, along with diuresis to reduce volume overload. Additional fluid would worsen the pulmonary edema. A pregnant trauma patient at 28 weeks gestation requires medication for pain control during transport. Which consideration is most important when selecting an analgesic? A. Choosing an agent with a favorable safety profile in pregnancy while adequately treating maternal pain, since untreated pain also affects the fetus. B. Withholding all analgesia throughout pregnancy regardless of pain severity. C. Using the highest available dose to ensure adequate maternal analgesia. D. Avoiding any FDA pregnancy category consideration since transport is short-term. The correct answer is choosing an agent with a favorable safety profile in pregnancy while adequately treating maternal pain, since undertreated pain also affects the fetus. Analgesic selection in pregnancy balances effective maternal pain control against fetal risk. Untreated severe pain itself can cause maternal catecholamine release and reduced uteroplacental perfusion, so appropriate, judicious analgesia is preferred over withholding treatment. A pediatric patient is being secured for ground transport. Which securement approach is most appropriate? A. An age and weight appropriate car seat or pediatric transport restraint system compatible with the vehicle. B. The standard adult stretcher harness alone, regardless of the child's size. C. Holding the child securely in a caregiver's arms during transport. D. A blanket wrapped snugly around the child without additional restraint. The correct answer is an age and weight appropriate car seat or pediatric transport restraint system compatible with the vehicle. Pediatric patients require securement devices appropriately sized for their age and weight. Integrated safely with the transport vehicle, adult restraints do not fit properly, and holding a child in arms provides no crash protection. A transport nurse discovers a colleague diverting fentanyl from the transport medication kit. The nurse's legal and ethical obligation is to A. Report the suspected diversion through the appropriate mandatory reporting and agency channels. B. Confront the colleague privately and let the matter drop if they apologize. C. Say nothing to avoid damaging a professional relationship. D. Wait until the colleague is caught by someone else before taking action. The correct answer is report the suspected diversion through the appropriate mandatory reporting and agency channels. Suspected medication diversion is a mandatory reporting obligation in most jurisdictions and licensure boards. Both to protect patient safety, diversion often correlates with impaired practice and to comply with legal and professional accountability requirements. Prior to accepting a flight, deteriorating weather is reported along the planned route, who holds the final authority to decide whether the mission proceeds. A. The pilot in command. B. The flight nurse. C. The communications specialist. D. The receiving facilities medical director. The correct answer is the piloting command. Aeromedical risk management principles and a sterile, non-punitive safety culture give the piloting command final authority over the go-no-go decision, independent of clinical urgency, so that no crew member feels pressured to fly into unsafe conditions. A transferring hospital requests helicopter transport for a patient in active labor with a non-reassuring fetal heart tracing. Under Tyler, which of the following must occur before transfer? A. The transferring physician certifies that the benefits of the transfer outweigh the risks, and the receiving facility has accepted the patient. B. The patient must sign a general consent form only. C. The transport service must independently verify the diagnosis before accepting the flight. D. The transfer may occur only after the fetal heart tracing normalizes. The correct answer is the transferring physician certifies that the benefits of transfer outweigh the risks, and the receiving facility has accepted the patient. EMTALA requires that for an unstable patient to be transferred, a physician certify that the medical benefits of transfer outweigh the risks, appropriate stabilizing treatment be provided within capability, and the receiving facility formally accept the patient. A flight nurse self-reports an inadvertent medication administration error that caused no patient harm. Under a just culture model, the organization's response should primarily focus on A. Analyzing the system and process factors that contributed to the error. B. Disciplinary action against the nurse to deter future errors. C. Suspending the nurse's flight privileges pending investigation. D. Requiring the nurse to complete remedial competency testing before any review occurs. The correct answer is analyzing the system and process factors that contributed to the error. A just culture balances accountability with a non-punitive approach to honest human error, focusing on identifying and correcting system and process contributors rather than defaulting to blame, which encourages transparent self-reporting. During ascent, a flight nurse notices the pilot restricting cabin conversation to essential communication only. This practice is best described as which safety principle? A. The sterile cockpit rule. B. Crew resource management debriefing. C. Aeromedical risk mitigation AMM. D. As situational awareness training. The correct answer is the sterile cockpit rule. The sterile cockpit rule restricts non-essential conversation and activity during critical phases of flight, such as takeoff, landing, and low-altitude maneuvering, to keep the pilot's full attention on flying. The flight nurse is dispatched to the scene of a motorcycle crash. The patient has had extensive blood loss from a partially amputated lower extremity. No treatment has been initiated. Vital signs are as follows: BP is 334 mm Hg, HR 346 beatsman, RR 43 breathsman. As the nurse prepares to initiate the massive transfusion protocol, which of the following interventions should be the highest priority? A. Application of a tourniquet. B. Administration of tranexamic acid TXA. C. Administration of blood products. D. Initiation of fluid lactated Ringer's solution at a wide open rate. The correct answer is application of the tourniquet. For active, life-threatening extremity hemorrhage, immediate mechanical control with a tourniquet takes priority over all other interventions. Hemorrhage control comes before fluid, blood product, or pharmacologic measures consistent with the exsanguinating hemorrhage step preceding airway in trauma resuscitation. A transport patient with a history of sickle cell disease presents with severe bone pain, tachypnea, chest pain, and hypoxia. The transport nurse should suspect A. Acute chest syndrome. B. An uncomplicated vaso-occlusive pain crisis without pulmonary involvement. C. Spontaneous pneumothorax. D. Pulmonary hypertension unrelated to sickle cell disease. The correct answer is acute chest syndrome. Acute chest syndrome is a life-threatening sickle cell complication presenting with chest pain, hypoxia, tachypnea, and new pulmonary infiltrates, often accompanying a painful crisis. It requires oxygen support, aggressive pain control, and consideration of transfusion therapy. A patient with chronic kidney disease and missed dialysis session presents with peaked T waves on ECG and generalized weakness. The transport nurse should recognize this as a sign of a hyperkalemia requiring urgent stabilization en route. B. Hypokalemia requiring potassium replacement. C. Hypocalcemia requiring food for fluids alone. D. Hyponatremia requiring free water replacement. The correct answer is hypokalemia requiring urgent stabilization en route. Peaked T waves are an early ECG sign of hypokalemia, common in dialysis-dependent patients who miss sessions. Stabilizing measures such as calcium gluconate to protect the myocardium and agents that shift potassium intracellularly may be needed during transport. A patient with known adrenal insufficiency who missed steroid doses presents with hypotension refractory to fluids and vasopressors, along with hypoglycemia. The transport nurse should anticipate administering A. Romafor hydrocortisone, B. Romafor insulin, C. Romafor levothyroxine, D. A. Romafor calcium gluconate. The correct answer is Romafor hydrocortisone. Adrenal adenosine crisis presents with refractory hypotension and hypoglycemia due to cortisol deficiency. Romafor stress dose hydrocortisone is the definitive treatment and often produces rapid hemodynamic improvement when vasopressors and fluids alone are insufficient. Using the Parkland formula for a 70 kg patient with 40 total body surface area burns, how much crystalloid should be administered in the first 8 hours post-burn? A. 5,600 ml, B. 11,200 ml, C. 2,800 ml, D. 8,400 ml. The correct answer is 5,600 ml. The Parkland formula is 4 ml x weight kg x TBSA burned, giving a total of 4x70 x40 equals 11,200 ml over the first 24 hours, with half of that total 5,600 ml given in the first 8 hours post-burn. During a long ground transport over rough terrain, the transport nurse notes the patient becoming increasingly nauseated. Which physiologic stressor of ground transport is the most likely contributor? A. Vibration and motion affecting the vestibular system. B. Decreased barometric pressure. C. Reduced partial pressure of oxygen. D. Thermal stress from cabin altitude changes. The correct answer is vibration and motion affecting the vestibular system. Ground transport vibration and repetitive motion stimulate the vestibular system and can produce motion sickness and nausea. Unlike air transport, barometric pressure and partial pressure of oxygen changes are not significant stressors in ground transport. An ambulance approaches an intersection with the emergency lights and siren activated. A crossing vehicle does not yield. The driver should come to a complete or near complete stop and visually clear the intersection before proceeding, since lights and sirens do not guarantee right-of-way. B. Proceed through at normal speed since emergency vehicles always have right-of-way. C. Increase speed to clear the intersection before the crossing vehicle arrives. D. Disable the siren to avoid startling the crossing driver. The correct answer is come to a complete or near complete stop and visually clear the intersection before proceeding, since lights and sirens do not guarantee right-of-way. Emergency vehicle operations training emphasizes that lights and sirens are a request for the right-of-way, not a guarantee. Drivers must slow or stop and visually confirm the intersection is clear, since other motorists may not see or hear the emergency vehicle in time to yield. A geriatric patient requires sedation for a procedure prior to transport. Compared with a younger adult, the transport nurse should anticipate that this patient will typically require a lower medication doses with slower titration due to reduced drug clearance and altered pharmacokinetics. B. Higher medication doses because of increased drug tolerance. C. The same dosing as a younger adult with no adjustment needed. D. No sedation at all, since geriatric patients cannot safely receive sedatives. The correct answer is lower medication doses with slower titration due to reduced drug clearance and altered pharmacokinetics. Reduced hepatic and renal clearance, decreased lean body mass, and altered volume of distribution in older adults increase sensitivity to sedatives and analgesics, generally requiring lower doses administered more slowly with close monitoring for respiratory depression and hypotension. A patient with a suspected cervical spinal cord injury at C5 presents with a heart rate of 44 beats per minute and blood pressure of 7 is at 140 mmHg with warm, flush extremities below the level of injury. This presentation is most consistent with A. Neurogenic shock, B. Hypothalamic shock, C. Spinal shock without hemodynamic compromise, D. 8. Cardiogenic shock. The correct answer is neurogenic shock. Disruption of sympathetic outflow from a high cervical spinal cord injury causes unopposed vagal tone bradycardia and loss of vascular tone hypotension with warm extremities, distinguishing neurogenic shock from hypothalamic shock, which typically presents with tachycardia and cool extremities. A patient in septic shock remains hypotensive after 30 mLkg of balanced crystalloid. The transport nurse anticipates initiating a vasopressor. Which agent is considered first line for septic shock? A. Norepinephrine, B. Phenylephrine, C. Dopamine, D. Vasopressin as a standalone first agent. The correct answer is norepinephrine. Norepinephrine is the first-line vasopressor for septic distributive shock due to its potent alpha-adrenergic vasoconstriction with modest beta-adrenergic inotropic support and a more favorable FEV profile compared to dopamine. A patient with an inferior STEMI develops a heart rate of 38 beats per minute and blood pressure of 82 to 50 mmHg. Which medication should the transport nurse anticipate administering first? A. Atropine, B. Adenosine, C. Amiodarone, D. Metoprolol. The correct answer is atropine. Symptomatic bradycardia with hypotension is treated first line with atropine to increase heart rate via vagolytic effect. Inferior STEMI commonly involve the right coronary artery, which supplies the SARV nodes, making bradyarrhythmias a frequent complication. A transport patient develops sudden dyspnea, hypotension, and hypoxia several hours after a long bone fracture repair. The transport nurse should suspect a fat embolism syndrome, B. Acute exacerbation of asthma, C. Spontaneous pneumothorax unrelated to the fracture, D. Anxiety-related hyperventilation. The correct answer is fat embolism syndrome. Fat embolism syndrome classically follows long bone fractures or orthopedic procedures presenting with a triad of respiratory distress, neurologic changes, and a petechial rash, typically within 2,472 hours of injury. It requires supportive respiratory management and close monitoring. The transport team is preparing to load a bariatric patient for transport. The nurse is most concerned about which of the following risks from positioning the patient flat during loading or transport. A. Gastroesophageal reflux. B. Alveolar hyperventilation. C. Decreased functional capacity. D. Increased cardiac output. The correct answer is decreased functional capacity. Positioning a bariatric patient supine allows abdominal contents to compress the diaphragm, reducing functional residual capacity and predisposing to rapid desaturation. A reverse Trendelenburg or Sandy Fowler's position is preferred whenever possible. Immediately after intubation, the transport nurse notes absent breath sounds on the left, present breath sounds on the right, and rising echo 2 with a normal waveform. The nurse should first suspect a right brainstem bronchial intubation, B. esophageal intubation, C. the large left-sided pneumothorax present before intubation, D. ventilator circuit disconnection. The correct answer is right brainstem bronchial intubation. A normal capnography waveform confirms tracheal placement, ruling out esophageal intubation. Unilateral absence of breath sounds on the left with a present waveform on the right most often indicates the tube has advanced too far and entered the right brainstem bronchus. A patient being transferred between facilities requires ongoing treatment that exceeds the transferring hospital's capability. Under IMTALER, the transferring facility must A. provide stabilizing treatment within its capability and obtain acceptance from the receiving facility before transfer. B. obtain a court order before any interfacility transfer. C. transfer the patient immediately, since capability limitations exempt IMTALER requirements. D. delay transfer until the patient's insurance authorization is confirmed. The correct answer is provide stabilizing treatment within its capability and obtain acceptance from the receiving facility before transfer. IMTALER requires that a transferring facility stabilize a patient to the extent of its capability and secure formal acceptance from an appropriate receiving facility before transfer, regardless of the patient's insurance or payment status. How many did you get right? Let us know in the comments and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.